Our group scenario is an Indian first-time mother, tense and afraid, as she enters the transition phase of labor and speaks no English. Her husband speaks very little English, but views childbirth as woman's work.
Stephanie, can you help me get the room ready?
I was supposed to be on break like 10 minutes ago.
Can you go get me some towels?
I don't have time for this right now.
We have a patient labor and she's on her way. Are you Snella? I'm Jen. I'm going to be your nurse today. How far apart are your contractions? How far apart are your contractions?
I don't know, it's her job.
I'm going to help you in the bed here. I'm going to try to get you as comfortable as possible. When did the contractions start? I'm just going to take a listen. Okay, we're going to get the doctor in here.
Hey Snella, how's it going? Let me check you out here. Wow, you are so pregnant. Looks like really painful. Looks like you're about to pop, but let me just get you out here real quick.
How's she doing in here? Is she in a lot of pain?
She said it hurts. How long?
Well, we paged the doctor, so she'll be able to tell us more when she gets here. Stephanie, did you get a set of vitals on her?
No. I don't have time for that. Smell you later.
It's going to make you more comfortable. Here, her contractions are getting closer together.
All right, thank you, Jenna. Hi, Snella. You want to check your cervix? I know you're in a lot of pain. Have you? Okay, Jenna, she's about 8 centimeters right now. Okay.
How many centimeters is she?
Yeah, she is so pregnant.
Is this your first baby?
It's so annoying.
Stephanie, what you did earlier was inappropriate. You need to respect the patient's privacy. Everything needs to be kept confidential.
Okay, whatever. I'll remember that next time.
Nurses, it's time. First now. Hey Snella, we're going to check your cervix again. She's 10 centimeters. She's fully dilated.
Ew.
She's ready to push.
You guys got this. I'm going to get something to eat.
Like, I'll totally show you where the cafeteria is.
Samuel, we need you here. Your wife needs your support.
It's woman's work.
Hey Snella, you're ready to push. Okay, ready? Push.
Oh my god. Oh my god, this is so gross.
Harder.
Oh my god.
Okay, his head's coming out. It's a boy.
Awesome.
He's 7 pounds, 4 ounces, 21 inches long. Do you have a name picked out for him?
Stanley James. Can I hold him?
Yeah. Just make sure you support him.
कितना प्यारा है ना?
Believe it or not, the baby's 3 days old now. We're going to get ready to go home.
Here's your brochure.
This just shows what to expect in the next few days with the baby. There's emergency contact numbers, and also make sure you follow up with your pediatrician in a week. And we're just going to help you get in the wheelchair.
Temperature is going to be for baby, respiration for all normal, blood pressure was 120.
May nurse ko din siya during the check on care schedule. Once you have this.
Oh my God, so cool.
We appreciate it, but we can't accept that. Thank you very much. Good luck with everything.
Thanks.
During the pre-interaction phase, Jenna tries to prepare the room for the incoming patient and discuss what they were preparing for, while Stephanie is preoccupied with other things and worried about getting off to break on time. The orientation phase showed Jenna introduce herself to the patient, get her comfortable, and assess her vitals, as Stephanie was on break, who then comes in without addressing herself or the patient properly. In the working phase, Jenna called the doctor as the patient's pain increased. Her and the doctor then explained to the patient what was going on and what would be happening. Jenna also tried to encourage the father to support his wife, while Stephanie wasn't concerned with what was going on with the patient and just observed. The termination phase entailed the nurses preparing to send the patient home. Stephanie gave the patient information but failed to explain it. Jenna then stepped in to discuss the brochure and reminded the patient to follow up in 1 week. While saying bye, the patient tried to give the nurses a gift, and as Stephanie immediately accepted it, Jenna appreciated the offer and returned it.
Verbal cues. The bad nurse had an attitude, was carefree, and ignored the language barrier. The good nurse's voice was calm and reassuring. Nonverbal cues. The good nurse maintained eye contact with a calm expression. The good nurse touched the patient in a supporting way within the social zone. And the bad nurse wore her badge below her waist, had her hair untied, had on excessive makeup, and had visible tattoos. Bridges and barriers. The bad nurse showed a lack of empowerment by throwing the brochure at the patient. The good nurse showed empowerment by explaining what was in the brochure and sharing her knowledge. The bad nurse showed lack of caring by making sure she went to break on time and ignoring the patient's comfort. The good nurse showed she was caring by being attentive to the patient's needs and comfort. The bad nurse allowed another one of her patients to invade the other patient's privacy, then provided more information on the side, showing a violation in confidentiality. The good nurse maintained confidentiality by drawing the curtain to protect the patient's privacy and approaching the bad nurse about her breach of confidentiality.
During our scenario, we used Swanson's theoretical view of caring. The good nurse was protecting her privacy, comforting her through her pain. She also informed the patient throughout her hospital stay and offered support when the husband wasn't being involved.